Yeah? Is it okay? I don't know who was talking and who answered, but apparently it's solved. Is that right?
Yes, it's solved now.
Yeah, okay. By the way, I don't know if I introduced myself. My name is Dick van Ginhoven. I've been working at the Ministry of Foreign Affairs for many years, about 20 years. Before that for the UN in many countries in the world, particularly UNICEF. And now I'm in Delft and I'm working as a consultant for water and sanitation and various assignments. Okay, next question. How many people in the world lack a toilet, don't have basic sanitation? Is that 1.8 billion people or 2.3 billion? If you think it's A, raise your hand. If you think it's B, just lower your hand. Okay, I see some hands up. That looks good. I'll go you. So the answer is 2.3 billion. So the people who didn't raise their hands are through to the next round. If you raise your hands, please switch off your video for some time till the end of the quiz. Yeah? Okay, I see something moving. We're getting less and less. Okay, next question. What is a VIP latrine? A latrine is an English word for a toilet, a basic outhouse. It's a toilet, a simple toilet. A VIP latrine is a latrine for very important persons, or is it abbreviation for a ventilated improved pit latrine? If you think it's one, or you raise your hand. If you think it's two, you don't do it. So nobody raises hand, I can see at least. Let's keep the answer is, of course, a VIP latrine is abbreviation for a ventilated improved pit latrine. A ventilated improved toilet. It's a small house where you can go to pee and poo. Next question. So the people who didn't raise their hands are through. If you raise your hand, please switch off your camera for a second. Yeah? Next question. How much profit, if you were a Minister of Finance in Tanzania or in the Central African Republic, how much profit can you or your economy make from an investment in clean drinking water and sanitation? Answer one is the profit is equal to investment. So if you put in, say, $1, you can equally get a return of $1. Or if you put in $1 or €1, you may get a profit which equals maybe 8 times that much. So is it answer A or B? If it's A, raise your hand. If it's B, leave your hand down. Okay. Well, the answer was B, so the people who didn't raise their hands are through. Yeah, to the next round. If you raise your hand, please switch off your video. The profit from an investment in water and sanitation is maybe sometimes 8 to 10, 20 times as much as from what you invested. And how is that possible? That's due to there's less treatment cost in the hospital of sick people. People are less sick and absent from the work. People are more healthy, more productive. And also it means that you save a lot of time because you don't have to walk, say, to the bush or somewhere else to go to a toilet, or you save time from fetching water. So an investment in water and sanitation is a very good investment for a Minister of Finance. Next question. What is, according to the British Medical Journal, the most important medical invention since 1840? This is something, since you are studying medicine, you want to be a doctor, important question. Is it sanitation, environmental sanitation, safe drinking water, pipe systems, and the provision of sewage? Or is it the discovery of penicillin, antibiotics? What is, according to your colleagues, the British Medical Journal, the most important invention? If it's A, you raise your hand. If it's B, you leave your hand. Okay, here we go. Well, according to your colleagues, your future colleagues, doctors, the most important invention, medical invention, was sanitation, to provide water through pipes and make people use toilets or connect them to a sewage system like we have in the urban areas. So sanitation, environmental sanitation, is the most important medical, well, you can say medical invention since 1840. So there's something we consider. I see we have a few people still on the screen, so we go on. Next question, what's the major cause of death for children under 5? Is it acute respiratory infections or is it diarrhea? So if you think it is acute respiratory infection, longontsteking as we say in Dutch, or is it diarrhea? This is for the global, children under 5 globally. If you think it's ARI, acute respiratory infection, raise your hand, please. Yeah? If you think it's diarrhea, you don't raise your hand. Yeah? You still there? Okay, I see a few hands. I see some people who don't raise their hand. Oh. The first cause for death is acute respiratory infections. I'm sorry for those people who raised their hands who thought it's always the first question. No, this case, it is ARI. That's the first cause of death for children under 5. Diarrhea is number 2. So for children under 5, most around the world, most people are dying from lung infections and not from diarrhea. The second is diarrhea. So I see a few people are leaving. I see still 2 on, is that right? I think I see 2 videos on. So let's see, who's there? Can you mention your name?
I'm still here. I'm Leonard.
Okay, Leonard, great. You're the only one now. No.
We're also still here.
Yeah.
Yeah, we see also
I'm also-
other people.
Okay, maybe
I think it's 15 people or something like that.
No, there are 8, I guess. 8
8.
with their.
How can you see? Let me see. I showed you.
That's the 8.
Great. Oh yeah, I see now. Yeah, sorry. That's good. That's better. I can see it now. Okay, about 8. Is that right? It looks like, eh? Anyway, let me not play too much, otherwise I mess up the whole thing. Okay, next question for those remaining still in the quiz for the bottle of wine. What's a flying toilet? It's an interesting one. Maybe you never heard about it. Is it the toilet in an airplane? Or is it a plastic bag full with shit that you kind of throw in the air and throw on the neighbor's roof, or you throw it away in the ditch? What is a flying toilet? If it's A, please raise your hand. If it's B, you'll have your hand down. Okay, good. A flying toilet is a plastic bag full of shit and somebody that you can throw away in somebody's garden, on his roof, or along the roadside. Let me tell you more about this. If you don't have a toilet in your house, how are you going to help yourself, relieve yourself? In the morning, for example, if you're in a crowded neighborhood. So what people do, they use a plastic bag, they poo in that plastic bag, or even sometimes they pee in it, and hopefully the plastic bag is not leaking. Then they close it, they go outside of their house, the small house, and they throw it often on the roof of the neighbor or on their own roof, or they just throw it away in the ditch or on the roadside. So this is what is called a flying toilet. So the people who have not raised a hand are through to the next round. Let's see how many we still have now. Let me try to see it. We still have a few here. Oh yeah, I still have 8. Is that right? Oh. Let me see. Yeah, 8, I think. Okay, last question between the 8. And I see there's one video that has 2 persons who's that?
Yes, we're watching this lecture together.
Anna, it's Anna den Bruder, right?
Yeah. Yes,
Okay.
that's me. We're roommates, so that's why.
Your roommates, okay, so that's good, that's good. So how are you going to deal with this bottle then? Are you going to share?
Yeah.
Okay, so give it a try, And,
Okay.
okay, last question, and the person who is closest to the right answer will be the winner, okay? How much time do you spend on average, a Dutchman or a Dutch woman, per year on the toilet? How much time? You can either do it in hours, you can do it in days, whatever you wish. Now let me try, I will write your answer, because okay, let's start with the 2. Was that Anna? Anna, why don't you start?
We zijn nog making a quick calculation. How many minutes?
8 minutes.
8 minutes per day times
So that's about
2,920 minutes.
No, just give me the answer, then
49 hours.
49 hours.
49 hours. Okay. And then let's see, the person who's there, I'm not sure above. Can you see this? I don't know. Why don't you speak start on, if you're still in the race, give me your answer, mention your name and your answer, please. Okay?
So my name is Sikun, and I would say 89 hours.
Sigmund?
Sikun,
Yeah, Sigmund. And what's your answer?
89 hours.
89 hours. Okay, then next.
Is it me or?
That's Niels. Okay, Niels. Yeah?
I've got 42 hours.
42. Okay, next.
I'm Leonard. 107.
100. 100, did you say 100 or 110?
110.
110 hours. Okay, I've got 4 now. Who else is?
I'm Marilyn.
Yeah, Marilyn.
I
Good.
think it's 75 hours.
75 hours. That's about 10. No, that's 10 working days. That's a lot. Yes. Okay. Let's go. I have 5. I think I need still 2 more.
I am Mickey.
Mickey.
I think around 60 hours.
60 hours. Okay. Anybody left?
Yes, I'm Linda.
Linda.
I think 40.
40 hours. Okay. Everybody now there? 1? No, I think we got everybody, eh? Yeah? Okay. Let's see what the answer is. The answer is that's about 7 minutes a day. It's amazing, eh? 50 minutes a week, or about 43 hours per year. 43. So, wow, Niels, 42. I think you are closest, isn't it?
I think so too.
I think so too, Niels. Niels van Heteren. That's good. Well done. Well done. There's a nice bottle here. I will make sure that you get it, either through Jan Bouwen, or
that's fine.
Anyway. Very well done. Good one. And
thank you very much.
for joining in the quiz. I hope it's kind of enlightens a little bit this Zoom college, this Zoom lecture. I invite everybody back now on to switch on their video. If people are still listening but have not switched on the video, for me it's nice to see a few faces. Let's see now how many. Yeah, there are many more now. Good. Welcome back again. Now we're going to do a very difficult trick. As I mentioned to you, I like to show you. I stopped sharing my screen now. I will start sharing a screen, but that's let me. Oh, what happened? Okay, there we are again. I would like to show you a video about 20 minutes, and that video is on YouTube. So this is going to be really something. Please bear with me. Let me get it. I thought I had it already somewhere. No, it's not there. Okay, here we go. I'm going to. Let me close this one first. Can you see my screen now? I think so. Let's.
No, we cannot.
You cannot see. Okay, I should first share it. This is okay. Share screen. Okay, no, this one I want you share. Now you can see my screen?
Yep.
Yeah? Good. Now I must get rid of this PowerPoint. Okay, let's start the video and hopefully you can see that. Do you see the video?
Yep.
Yeah?
Yep.
Can you hear it?
Too.
Yeah? Can you hear it also?
Human life and human progress.
Yes, it's hearable, Dick.
Water.
Okay.
Water that is
enjoy it.
and
I will come back to you once we are through. But I think this video is a very good video to highlight the transmission routes of diseases and things like that.
Used in its daily pursuit.
It's about 20 minutes.
Children too must join in the unending task. The goal of the 80s is to bring a safe and adequate water supply and sanitary facilities to as many people as possible throughout the world.
We zien de film nu niet, Dick.
Nee, ja, ik zie het. Ging bij mij ook, is bij mij ook knikken weg. Ik ga even wat weghalen. Sorry for this.
However, the task is
there
enormous.
it is.
Yep.
For more than half of the people in the developing world do not have enough safe water, and the population continues to grow. Lack of knowledge about disease leads to practices hazardous to health. Wells lie unprotected and open to contamination. Even if the water source is safe, the surroundings are often polluted, and the water is in danger of becoming contaminated before it is used. And the water that is not used may become a breeding ground for disease. Few people are dirty by choice, But as long as they live in such environments, clean water alone will make little difference. The task of the 80s is even more difficult because about 3/4 of the people in the developing world do not have adequate sanitary facilities. With contamination from human and animal feces, household and industrial wastes, water, the sustainer of life, becomes an agent of death. Cholera, typhoid, dysentery, and other waterborne diseases kill thousands of people every day. But the main culprit is not water. It is man's inability to safely dispose of his own feces. Whether the fecal contamination is transmitted through food, insects, or water, it often leads to the same thing: diarrhea, dehydration, and death. Acute diarrhea can strike people of all ages, but every year it kills about 5 million children under 5 years of age. Repeated attacks of diarrhea will eventually lead to severe malnutrition, a condition which kills millions more. There is little hope of preventing such sickness and death as long as people get their water from polluted sources. Although water can be made safe by boiling, most people do not have enough firewood to boil drinking water on a regular basis. As the dry season advances, the lineup at the well grows, and people wait longer to take home their share of water, water that is polluted. A family may have plenty of nutritious, well-cooked food, but no access to clean water. Surface water is seldom safe for drinking. It is easily contaminated by both animals and humans. Human wastes are especially dangerous because they may carry bacteria, viruses, and parasites, which can cause diarrheal disease. These organisms cannot be seen except with a microscope, but they will be represented in this film by the moving gray-white color you see here. This contamination can quickly spread to be brought home by anyone drawing water for their family. The family's water is used for more than cooking or washing. It is usually consumed directly, and it takes only a very small amount of such contamination to cause diarrheal disease. Disease can spread from one person to the whole community through water. The same water is used over and over for different purposes, and the contamination increases. Although moving rivers and streams may look clean, they're usually full of these invisible and dangerous organisms. It is better to use water from wells. However, using a well does not guarantee clean water. Often the area around the well is also contaminated with human and animal waste. If the well is open and unprotected, such contamination will soon make contact with the water inside. There is no way to keep an open well clean. So families who consider themselves fortunate to have a well may be no better off than those who take their water directly from rivers and streams. In many families, the older children look after their younger brothers or sisters. While the contaminated water may not make the older children sick, it could be a deadly poison for the younger ones who have not had time to build up a resistance to the contaminants in the water. Contamination and disease are ever present in many homes. Lack of cleanliness in preparing and serving food, and the practice of allowing food to stand at room temperature for hours, increases the risk of diarrheal disease. And it is the weakest members of the family, the very old and the very young, who are the most common victims. Unfortunately, it is often the mother's hands that pass the contamination from a sick child to other family members by way of food and water. Contamination can easily spread through the household. For example, a mother in the middle of preparing a meal has to attend to a child with diarrhea. She washes her hands after cleaning the child, but she does not scrub thoroughly, nor does she use soap. Like many people, she thinks that her child's feces are harmless. When she returns to the kitchen, her hands are still contaminated. The contamination is passed on to food and dishes. The contamination is then passed on to other family members, and the whole family may soon be ill. When children are sick with acute diarrhea, they must be treated promptly, for they are rapidly losing essential body fluids and may die. Mothers should be given thorough instruction on why children get diarrhea and on the proper way to give oral rehydration solution. The solution is a mixture of water, glucose, and essential salts, which replaces missing body fluids and helps restore the appetite. The child should also be breastfed or given energy-rich foods as soon as he or she will eat. Oral rehydration and good food can save lives, but they will not prevent the child from getting sick again. The mother and child will continue to spread contamination to one another unless changes are made in household hygiene. Diarrheal disease will remain with the family when poorly washed hands touch food directly, when water is contaminated by hands, or is left unprotected from birds and animals, and when bottles, dishes, utensils, and food are not properly protected. The home is by no means the only source of contamination and disease. Without basic sanitation practices, the whole environment becomes contaminated. Disease is spread by the runoff from wells, kitchens, and poorly built latrines. Some latrines are built too close to wells, resulting in contamination of drinking water. Or they may be built over rivers, which spreads pollution even further. Even if latrines are properly constructed, they may be poorly maintained and will become a source of disease. And soon people will stop using such latrines, with inevitable results for the next person who draws water. Many people believe that it is not really harmful to defecate in an open field or behind a bush, an understandable practice if latrines are poorly maintained. When a latrine is built on higher ground than a well and too close to it, contamination will reach the well through underground seepage or be washed into it by heavy rains. Polluted water, poor sanitation, and lack of basic hygienic practices create a vicious cycle of infection and reinfection. The result is that many villagers are needlessly sick several times each year. And yet most of these problems can be eliminated by a few relatively inexpensive actions. To begin with, the area around the well should be kept clean. A concrete liner should be built down inside the well. But as long as the well is open, the water can still be contaminated, so the well should be covered with a concrete cap. A reliable hand pump should replace the bucket and rope. The surrounding area should have good drainage to prevent runoff water from contaminating the well and from forming stagnant pools where insects can breed. One alternative is to use the runoff water for irrigating a vegetable garden. A separate concrete surface should be constructed for washing clothes and bathing, and the well area is complete. But even the cleanest drinking water will do little good in a dirty household where it can be easily contaminated. The yard around the house should be kept clean and waste properly disposed of. And kitchens kept clean will also reduce the risk of diarrheal disease. Water should be placed out of reach of animals and young children. The containers should be covered to prevent contamination by birds or by objects that could fall in. Water for cooking and drinking should be kept separate from water stored for other uses. It is especially important that hands be washed thoroughly after the latrine is used. If soap is not available, ash is the next best substitute. In fact, washing with soap or ash before handling food is essential for breaking the cycle of disease in the home. Dishes should also be cleaned thoroughly, and feeding bottles should be sterilized by boiling. But for the infant, breastfeeding is better protection against diarrheal disease, since mother's milk contains substances that prevent infection and is the best food. If a family practices good hygiene, the household will no longer be as great a source of infection and reinfection. But as long as the surroundings are contaminated by feces, diarrheal disease will remain a major problem. What is needed is a latrine that can be kept clean. Almost all communities can afford at least the basic pit latrine. and it is important to remember that latrines should be located downhill and away from the well. To bring about such changes in the community, people must work together. New ideas imposed on a village may not have any long-term effect if the villagers have not participated from the beginning. Village committees should take on the responsibility of selecting the site for the new technology and should provide labor and, if possible, materials.
Pansamantala, ano po ang mabuti nating gawin para tayo magkaroon ng kahit na pump water system muna?
By their involvement, the new water and sanitation system will be truly their own. The choice of technology is important. Although there is no such thing as a perfect hand pump or a perfect latrine, that choice should take into consideration such factors as the funds and materials available, soil conditions, and local customs. Hand pumps must be affordable, reliable, easy to install, and easy to maintain. Local people should be able to carry out most repairs. The availability of spare parts is an important factor, so there is a definite advantage to technology that can be manufactured locally. But technology alone will not bring about change in community health. There is a need for thousands of people in every developing country to be trained in the proper management of water and sanitation systems and in the promotion of good hygiene. People who will bring the message to their communities. Hygiene education for mothers is especially important because of their crucial role in the home. Households that adopt new hygiene practices will influence others to do the same. But health education should begin in the schools. Children are usually the first to take on new ideas, and they can have an important influence in the home when they start putting their newfound knowledge into practice. Millions of children die every year because they are born into surroundings full of dangerous organisms that cause diarrheal disease. The cycle of infection and reinfection can be broken, however. Clean water, good hygiene and sanitation, community involvement and education, these are the agents of change.
Okay. Are you still there? Can you hear me? If you can just flag a little bit to see, okay, that's good. That's good. How do you like the movie? Was it, it's an old one actually. It's not a very recent one, but it, what you have been seeing is still valid in many countries in Asia and Africa. So it's, I hope that this, this video gave you an impression of the importance of water and sanitation in terms of health. As the video was saying, many people, many young people still die because of the lack of water and sanitation and hygiene. And also it shows you the transmission routes of the water-related diseases. Now we talk all the time about COVID-19 and the way it spread and the need to wash hands, for example, and keep distance. But the same type of rules apply to water and sanitation related diseases like diarrheal disease or parasite infections, for example. So this is, I hope you enjoyed the movie, and it gave you good insight in the basics behind the need for water and sanitation, why we should invest and make safe water available to everybody in the world and make toilets available for everybody. Because one sick person, if there are no safe water supply, could easily infect a whole village or a whole community. Do you have any questions? If there's anybody who wants to raise a question, please feel free to do before we break for a coffee break. But I would like to give you the opportunity to share some of your views or raise a few questions to me to make it a little bit more interactive. Is there anybody, please raise your hand or just speak up, and then we will get to know what your question is all about.
I have a question.
Yeah, let's see. Danielle, is that right?
Yeah, you
Okay,
work at the Buitenlandse Zaken, I read. What do you do there?
What do I do there? Well, I was responsible for water and sanitation. As you may know, the Netherlands Development Corporation, International Development Corporation, provides quite a bit of funding. Actually, it used to be 0.7% of our gross national product to development cooperation. And I was responsible for the money that was going every year made available by you as taxpayers and your parents for water and sanitation. So that money was used to support programs from UNICEF, for example, or Aqua for All, but also we are supporting programs by the Dutch water utilities like Vitens Evides, for example, the drinking water company. We provide money to them so they can form a partnership with utilities in Africa or Asia to improve their operations and expand their program. So I was responsible for water and sanitation for the last, what was it, let's say 12 years. Any more questions?
Yeah, I've got a question. Could you say that on the area of sanitation and hygiene, like knowledge is the most important factor?
Yes, I think you're right. It starts with knowledge, but after knowing it in your head, you must practice it. So then it becomes behavioral change, as we call it in English. People have to start changing their behavior. For example, there's still, as you remember from the quiz, about 2 billion people who don't have a toilet. And these people, they go in the early morning, the men and women, in the field behind a tree, and they shit there and they pee there. And then they go back to their home, have breakfast, and go for the work. Now that behavior of using the field for open defecation, as we call it, that's very hard to change. To tell people to go and build a toilet and use it, to change from open shitting to indoor shitting is quite difficult because some people just don't like it. They think it smells, it's dirty. They like the fresh air. They like to have an open space. And well, it can be done and it's being practiced, and there are a lot of techniques now being promoted by agencies like UNICEF, for example, community-led total sanitation. A lot of knowledge is provided to people, but to change the behavior, that's the most important. You know, for example, to make people wash their hands after using a toilet, it's very difficult. Even in Holland, Leonard, if you go to a restaurant and you sit there, you have dinner, it's nice, and you're sitting close to the toilet, well, just watch how many people come out of the toilet, you know, kind of with still a little bit wet hands. Some people just go to the toilet and they come back and they eat. And they use, of course, they use fork and knives. But to change people's behavior, that's very important when it comes to hygiene. More questions? Some more? Okay, Niels, the winner, Niels van Heten, you have a question? Or are you gone for coffee already?
No, I don't have a question.
Okay, Niels, sorry to call you, but I still have your name here.
No,
because
no
I
worries.
shouldn't forget it. Okay, my suggestion now is we have a break for 10 minutes. I have it now 11:55, so we come back about 10 past 12, and then I'll tell you more about water and sanitation and all the programs that are going on in the world now to provide safe water and sanitary facilities to people. Okay, so let's meet again in 15 minutes, okay? Thank you. Zullen we maar weer beginnen? Ik zie dat er al een heleboel weer terug zijn. Nog niet alle video's zijn aan, maar toch al wel heel wat. Kunnen jullie me verstaan? Marit, kan jij me verstaan? Ja? Oké, prima, prima. Voordat we beginnen, even een zoekplaatje.
Dick, even in het Engels graag.
Oh yeah, sorry. Jan, sorry for that. Of course, in English. Before we start, just what we call a what's wrong kind of question to waken up and before we start the presentation. You see this picture, and I just want to ask you what's wrong with it. Just have a good look at the picture. There's something wrong with that picture. Maybe you can, I don't know if there are some very clever, talented people in the room, but there's something wrong with the picture. Have a good look at the picture, and if you think you know, just let me know. Nobody? The boy is washing his hands. That seems all right, isn't it? I assume you all can see the picture. Is that right? I've shared screen is on. Any suggestions about what's wrong with this picture? Nobody? His ears are all right and he looks healthy. Okay, let me tell you, if you see the tap, there should be here what we call a twister, something that you turn to open it and to close the tap. That one is missing. That in this case, if this container is full with water, it will just drain out. You can't close it. Isn't that funny? I don't know really why somebody took the picture. I just found it on the internet, but it's a terrible picture in that way. So again here, there should be a twister here. I'm sure this looks like a tap that most of you may have at the outside of your house, you know, in the garden, where you connect a hose to water the plants. That type of tap here, you can turn it and close the tap. Okay, let's start. I'm going to tell you something more about water, sanitation and hygiene, some of the challenges that we are facing as a whole, the world, and some of the opportunities and what we can do to do about it. First of all, I will say a few things about the importance of water. The Millennium Development Goals, you may know, and Sustainable Development Goals, which have replaced the Millennium Development Goals, the UN Millennium Development Goals by 2015, and we are now with the Sustainable Development Goals. I will say a few things about the history of water and sanitation in the Netherlands, talk a little bit about water, sanitation, and health as programs, water supply, sanitation. And also I come back to what we discussed briefly before during the questions on issues like behavioral change and enabling environment. What is needed to make change happen? Last thing I will talk about is good governance. That is, how do you, as a government, as a responsible government, how do you manage society and manage your programs to be really effective and to be, what shall we say, good. Huh? Okay, let's start with the importance of water. As you may know, we are all water. 60% of our body consists of water. Water is hugely important, and often we tend to forget, but water consists, your brain is made of water. Your blood 80%, maybe even more of your blood is water. So it's very important that we have water available. Without water, we can't survive. You can go without a month without food, but without water, you will be dead in a week. You will just die. You can't do with water. Now, knowing this, we have a lot of water on Earth. It's the same water that was there already billions of years ago. Most of the planet is covered by water, but only 3%, a very little bit of that water is fresh. We can drink and we can use, because salt water is not suitable for drinking. But unfortunately, most of that water, that sweet water, is now covered and contained in ice. And as we all know, planets are changing. Greenland, the North Pole, the South Pole, all of them are being warming, and we are losing that precious water. Less than 1% of all the fresh water is accessible that we can drink, but most of it is still in ice. What's happening now is that about a quarter of all the clean water that we have available in your house, actually in the Netherlands, we use it to flush our toilet. We are what we call a developed society. So of that precious water, that very precious sweet water, we use it to flush the toilet. And that's of course something that's, it's hard to understand. And maybe I think in future we'll be changing that. We're going to reuse that water and make it available again for people. But having said that, and we can all read it in newspapers even now, that a water crisis, a shortage of water is coming. You may remember that like California or cases like Barcelona, towns were running out of water, or Southern Africa, Johannesburg or Cape Town was running out of water. The water sources we're having are under pressure. It's not only because there's a little bit of it, but also because the population is growing and we're consuming more and more water. In the last decades, the use of water is growing 6 times. And the populations are growing. We may have in the next century, maybe an extra 3 billion people. Now we have about 7.8. There may be more people coming, and that will increase our water shortage. Now, what will that mean for the water use? As I mentioned already, there are more and more people experiencing water shortages. In California, it's a big disaster. There's not enough water. The population is growing, maybe up to 22 million, and there's not enough water available. In areas of Texas, for example, there are towns in Texas or El Paso, New Mexico, running out of water very soon. Central Florida could run out of water also. So really, water management is very, very important. We have to start using our scarce water better. Don't spill it, reuse it, and make it available for everybody. There's still in the world a lot of people who have less than 10 liters of water every day. The WHO, the World Health Organization, they say everybody should have at least 20 liters per day. But there are still millions of people, you can say maybe 1 billion, who doesn't have even 10 liters of water a day. But at the same time, we are spilling water. Like an average American, they use 500 liters a day. They spend many long times using showers. They spend a lot of water watering their garden, the golf courses, cleaning the car, whatever. They spend a lot of water, while at the same time, a lot of people don't have water. At the same time, we have migration issues, the refugee problem without water, and they're increased because what we see, for example, in areas like Afghanistan or areas like Yemen, people are migrating from areas where there's a shortage of water to areas where there's enough water. As the climate is changing, we see migration is also taking place. People cannot go without water, and they will start moving to areas where there is water. At the same time, rivers are being polluted because the population is increasing, waste is increasing, and the shortage of clean water is increasing as well. At the same time, many more people now who don't have a toilet. And this all results in increasing of deaths. As we saw in the movie, the children, they die, very young children. That's about every 15 seconds in the world, a child may die because of diarrhea. So before we run out of oil that was expected before, and we were looking for new sources of energy, we may run out of water. Also, as we are using so much water, the groundwater is depleting, and there's less water available to grow our harvests, to grow our crops. And that if we have serious shortages in food production, we have to find ways of importing food from other areas, or grow or be more careful with our food. Water and food are closely related. So our water problem is directly affecting our what shall I say, our food problem. A water problem is becoming a hunger problem. There's not enough food to eat. A lot of populations are experiencing food shortages. So what does it mean? Generally, we can say that the world as a whole, we are in need of water. We need water to survive, and increasingly we need water for our industry, but also for our agriculture, and of course for people. The world is thirsty, as we used to say. Now, knowing this, the United Nations, all the nations in the world, they developed a set of goals, what we call the Sustainable Development Goals, to make the world sustainable, to make it a world that can last for many centuries and generations to come. The Sustainable Development Goals, building on the Millennium Development Goals, started in 2015. One of these goals, number 6, is the Sustainable Development Goal for water, as we call it. And the goal is to ensure the availability, but also the management of water and sanitation for all, for everybody, by 2030. So we have still 10 years to reach that target. The goal started in 2015, and I must admit, we haven't made much progress, but I think the world as a whole is still on track, and it can still be done if the politicians are really on top of it, could provide and make sure that we have water available for everybody by 2030. But to do that, we have to manage it in a sustainable manner. We have, in fact, 17 goals. One is on poverty, one is on hunger, one is on education, one is on equality. There's one on urban development, economic development, and as I said, number 6 is on water and sanitation. The progress on these goals is monitored. In this case, WHO and UNICEF are monitoring the progress on sustainable goal number 6 to provide safely managed drinking water and sanitation to all. If we look where the task is most serious, where most of the people are living who don't have water available, safe water, you can see it is Africa, Sub-Saharan Africa, part of Southern Asia, and a few countries in Latin America. When we talk about sustainability, sustainable service delivery, to make sure that you have water today, but also tomorrow and the day after tomorrow, and many more days to come, that's a big issue. Like, for example, hand pumps are often breaking down. So we have now, and we more see it now, we are developing new systems to take out groundwater, lift groundwater from the soil and make it available to people. But in a lot of African countries, as you can see from this slide, many hand pumps are out of order, like Sierra Leone, it's about 2/3. The same applies to Cote d'Ivoire, Ivory Coast, and Congo, DRC, the Democratic Republic of Congo. When we look at sanitation, the absence of having a toilet, the same applies. So here again, you see it's particular Sub-Saharan Africa, with exemption of South Africa. South Africa is better, although many townships there are without good services. But particularly sanitation is Sub-Saharan Africa, large proportions of India and Southeast Asia. Within those countries, I must say, it's also not very well divided. The rich people may have the resources, may have water, may have toilets, and the poor people often lack it. So there's an internal problem in these countries as well. Well, as we discussed before, I mentioned in the quiz, many billions of people are without sanitation. About 2 billion people who don't have a toilet, and there's still a lot of people who don't use improved water sources, safe water, about 700 million people globally. Now, this is the global situation. So this is big, serious problem. Safe water and toilets. That's a big issue in the world and something we have to look at. Now, how did we do it in the Netherlands? Let's look how we solved this problem in the Netherlands. This is a picture of Amsterdam, 19th century. And here you see we had open canals. People were using the canal, the water, which was polluted, to defecate, to throw rubbish in. And at the same time, they used it with their boats. And they used it even sometimes for drinking, even for, like in my town, in Delft, where I'm living, the canals were used to take water from to make beer. And the beer was considered more safe. There was alcohol in it, more safe than just water. So people were drinking beer. But this was the situation in many places in the Netherlands. As you can see, it didn't differ so much from the video we saw before of countries in Asia or in Africa. In fact, in Amsterdam, at some stage, and that was, I think, in the 19th century, people were starting to collect night soil. Poo, the poop was called night soil in English, was collected. People were giving a bucket. That was Mr. Sarfati, which was a famous wethouder, middle kind of governor of the town of Amsterdam. He was given a concession to collect night soil, and buckets were distributed. And if you had to go to the toilet, you used the bucket, and that bucket was collected every early morning, and then the poo was taken out of town. And it was in 1866, we had cholera in Amsterdam. Many people died. I think it was about 10% of the people in the Jordaan area in Amsterdam died because of cholera. So in Holland, hygiene wasn't that that good as well. And the same applies to the water supply and sanitation. There are two things you need to know which are important that made this change. First of all, after the Second World War, 1945, we were getting a lot of support to rebuild our country, the Marshall Plan. And the Dutch government used that money to build concrete factories, to make cement. And with that cement, we could build sewer pipes. And most of our sewers are coming from that time and built from cement and sewer pipes, which were bought after the Second World War with support from the Americans, the Marshall Plan. So you can see from this graph, after that, sanitation, sewerage system improved, and now nearly everybody in the Netherlands is connected to a sewer. That's a very big improvement, and something we should be very much aware of. It also means that if they were built in 45, we start building them, most of them now need to be replaced. They are now 45 at 60, nearly 80 years old. So you will see that Amsterdam, Rotterdam, and Delft and the major towns will sooner or later, but I think sooner, start rebuilding their sewage networks. And that's going to cost a lot of money. Equally important was in 1954 when we established the Netherlands Waterschapsbank. Netherlands, it was a bank dedicated to investments in water. So in 1954, we created the Netherlands Waterschapsbank. That was after the floods in 53, when the biggest part of Zeeland was flooded. And with that money that the bank was able to attract from the capital market, we were able to build our water supply systems and rebuild our dikes and really build our infrastructure, water and sanitation infrastructure. So this was a very, very important event as well. So two events to remember, the Marshall Plan and the Nederlands Waterschapsbank creation. Okay, now coming back to health, your topic. You're going to start your studies. You have started your studies in Rotterdam, and you want to become a doctor. As we mentioned before, water and sanitation are very important to create a healthy population. Diarrheal disease still kill more children worldwide than other diseases like malaria or even HIV and measles combined. Diarrheal disease, the lack of hygiene, the lack of sanitation or safe water is one of the most important killer of children. And if we are able to provide safe water and sanitation and make people change their behavior, we'll be very effective in environmental health terms. Well, you saw it in the video. Our enemy, the biggest enemy, is feces, poop, human feces. They contain a lot of viruses, bacteria, but also parasite eggs that people can once they enter your body, can make you sick. And it's important to keep the feces away from your body. So once you expel them, they should be treated and taken care of. That's why toilets or sewer systems are so important. If you see that the lack of sanitation, what it means, for example, if you look at helminths, the parasites, there may be 2 billion people who are suffering from parasites, intestinal parasites inside your body. There are 1.5, 2 million people die every year because of diarrhea, the lack of proper hygiene, proper sanitary facilities. But also we have trachoma, that's a disease for the eye that's related to poor sanitation, or bilharzia for that matter. Many millions of people, 200 million people in the world have suffer from bilharzia. We have lung infections. Guinea worm disease is still prevalent in a lot of African and Asian countries. But diarrhea by far is the most important killer, and that's one of the most important reasons that we have to focus so much attention to water and sanitation and hygiene. Now, you may say, okay, then you have diarrhea, so what? The problem is if you have repeated episodes of diarrhea, like a child, if you have today diarrhea, you recover, but then if you have it again and again, that will affect your health very, very much. And repeated cases of diarrhea will affect your digestion, your food intake, and will make you grow less good. You'll become stunted, as we call it. Children who are affected by living in unsanitary conditions will have repeated episodes of diarrhea, and as a result, their growth is stunted. They will, grow, their height will be lower, but also their weight over age score will be less. You can see in some of these graphs that if that is prolonged for longer time, people are living in unsanitary situations and they don't have a toilet, they are using open defecation, they may be stunted as well. There's a strong correlation between the height of children and the sanitation and hygiene environment. If you look at the way the intestines function, you will even see that this is a cross cut of an intestine, a darm, as we say in Dutch, that a healthy darm we have this cross section. It's much better able to absorb food than an affected intestine, which is suffering from a diarrheal disease and is not making it difficult to absorb all the nutrients from the food. So even if you have food, but you're suffering from diarrhea, you may not be able to benefit from the nutrition as much. Now, how do you what shall I say? This one is in Dutch, and sorry for that. But if you want to prevent people getting diarrhea, you have to prevent and cut the transmission routes from this disease. Like if you're getting diarrhea from feces which were contaminated, you could be either infecting somebody by shaking hands when his fingers are dirty, or flies may come up your food and you get ill, or dust or polluted water may come, and make you sick. So these transmission routes, either through your fingers or from flies or from polluted water, it's important to cut those transmission routes. Like, for example, if you're able to do hand washing, you can clean your hands and you will reduce the infection from feces to the new host, and by washing hands. The same, if there are many flies, you should protect your food from the flies by storing your food in a safe place, as such, not infecting the new host. The same applies for eating, using fork and knife. That will help you just to not getting infected. Well, the same applied for, as we discussed and saw, for water. If the water is polluted and you don't have a good well or a treatment of the water, you can still get sick. So you have to understand the transmission routes of these diseases if you want to able to cut and to reduce the number of infections rates. Now, I would like to to say one thing about the age. If young children, say from the age of 0 to 2, if they are living in an unhealthy environment, they're raised not in a hygienic manner, then their growth will be stunted. The height and the weight, they will not develop into full healthy children. And that first 2 years are critical. They are there forever, as UNICEF said. So it's very important that children, when they are born, are being raised in a healthy, hygienic environment. Otherwise, they will not, develop according to weight for age and the weight for height. The age for height and the age for weight statistics that normally healthy children should follow. So the first 2 years, young children are very important. As I mentioned, hand washing is critical to cut the transmission route of diarrheal disease. If you practice hand washing with soap, it can reduce diarrhea risk with maybe half. Similarly, even the lung infections will be reduced because people have clean hands. They don't touch their mouth or nose so often. And even the birth attendants, for that matter, if they are washing their hands, all of it will reduce the transmission of diarrheal disease. Well, here you have some interventions listed: the water quality, the hand washing, the sanitation, education. They all have an impact on diarrhea morbidity. The water quality, of course, is very important and most important, but hand washing is a good number 2 when it comes to improving the health status of the people. Sanitation, building a toilet, using a toilet are the 3 most important interventions to work on to improve people's health. Now, we already discussed, I think it was one of the questions about the need of knowledge, the need of education. In school, that's the place where young children are being educated about the need to use the toilet, to need to boil water if it's polluted, but also to wash their hands. But unfortunately, at schools, even there are no toilets. There's no water, safe water. So there are programs being launched by organizations like UNICEF to have, let's say, at schools, toilets for boys and girls. And that's a very important program, because that's where you reach the younger generation in order to build a healthier society. Also, for girls, I would like to say a few words about girls in school. It's very important for girls, as you may know, at the age of 10, 11, 12, they will be starting to have their periods, and there's a need for them to either have change some of the pads, or be able to have a good toilet to clean themselves. And this is very important, because if that facility is not available at school, they may miss 10 to 20% of their school days. And that will mean they will already at the early school, the lower primary school, they will be lagging behind when it comes to boys. So their education is affected, and maybe sooner or later also their place in society. Now, let me go a little bit. So we have a problem when it comes to water and sanitation. It's a problem, global problem, and sustainable development goal problem. A lot of people don't have access to safe water. A lot of people don't have a latrine. We have a problem between rich and poor. We have a problem with the men and the women. And also we see that the resources, the budgets we have are not always that well targeted to the right target groups. As I mentioned before, people require water for domestic use, for drinking, cooking, and washing, but also for productive use, say for gardening, for the animals, the chicken, the cows, the goats, but they also need water, and increasingly more water for industry. So when we look at water, we have to look at all the uses of water for people. So as some people in, I think this was Colombia said, we don't need very good quality. We need water for crops. We need water to drink coffee, but we cannot irrigate with coffee. So what they're saying is that we need water to grow our food, to produce our food, and of course we need a certain amount every day to drink. And I think when it comes to providing water, we have to differentiate these two uses, drinking water and water for productive use. Multiple use. In some cases, we see that villages are being provided with water that can be used for agriculture, but also for drinking water. And now it depends on the volume of water that you're providing, whether you have enough water, for example, to irrigate your crops and enough water for domestic household consumption. When it comes to domestic household consumption, we see increasingly that there are solutions being sought, particularly in the rural areas, to drill a hole, put in a pump, either a hand pump or a solar pump, and bring the water to the surface. And from there, we saw and we see that people carry it in containers to the household, but also increasingly we see that small networks are being, pipe systems are being developed, that water is elevated to an up-tank reservoir, a tank, elevated tank, and from there it's being provided through pipes to the households. But this, of course, needs a management system. You need trained people to maintain that system and make sure that, for example, there's not too much leakage so the water is leaking away. There are potential for manual drilling. You don't need always drilling rigs, drilling machines, but you can do that as well if the soil conditions are right. By manual drilling, and in many countries we see small entrepreneurs who are building up the company, setting up companies that can drill for water, and from there set up a management system to distribute, to build a distribution network, and then provide to the people. Increasingly, we also see on the market, what should I say, small bags or small containers that provide treatment at household level. So people take water, but not sure whether it's safe enough, and they use some small tablets or some small chlorine, drops of chlorine to make it portable, to make it safe for drinking. In the schools, as I mentioned already, there are a lot of schools now and a lot of programs where we are not only providing the facilities, but we're also educating the teachers to inform the children about the hygienic behavior. I mentioned already before that some people do use the field. They don't have a toilet. They pee and they poo in the field. And having that say, uncontained disposal of human feces that really does affect statistically, as can be seen statistically from this slide, the health of the people and the stunting of the children. Open defecation, making people making people to start using latrines is a very important program now being implemented by UNICEF in many African and Asian countries. Now, when it comes to priorities, that may be good to if you ask someone in Asia or Africa, what are your priorities? If we give you, say, $1,000, where would you spend it on? You'll see that men are increasingly interested to provide water, a water tank, or a good house, or spend money on education, or TV, or buy a cow, arrange for the marriage. Women give priority to houses, that one. To houses or education and marriage. So we see there are priorities, and water and sanitation have a high priority. Water has a higher priority than sanitation. That's understandable, I would say, but in many cases, if you're able to provide, say, a micro loan, some subsidy, people will be tempted to build a latrine and build a water system. So in conclusion, water, sanitation, hygiene are central to health. And health means nutrition. To change people's behavior is equally important. It's not knowledge, it's programs that make people change their behaviors. There are good opportunities for programming, and many governments and agencies like UNICEF are already working on it. But still, much more need to be done. On sanitation now, what does it look like? This is a picture of a latrine. You see many people don't maintain them, and they once they are filled, they kind of become in disuse and neglected. Building a latrine, building a hole in the ground, and putting a superstructure, that's fine. But we have to remember that, say, in about 5 years, this latrine will be full and it needs to be emptied. So sustainable sanitation means that you build a system that is managed well, that is protecting the environment, breaking disease, the cycle of diseases, but it's also acceptable by the people and managed well by the people. We have opportunity to reuse some of the components. Like in this diagram, you see that the feces are collected, but the urine can be diverted, collected in a bottle, for example, and used as fertilizer. Urine, in essence, is a sterile fluid that can be reused. So increasingly, we see what is called ecological sanitation, that people start to separate the feces from the urine and use the urine for the field and have the feces composted, and at some stage, when they are safe, can be reused again. So when we look at toilets, we can see that, of course, they're expensive. For poor people to build a toilet is not something easy, or even to be connected to a sewer will cost money. So people start with simple latrines that can be gradually improved till a better stage, with a roof, with a good door, with a nice pour flush bowl, for example, cemented, easy to clean slab. You don't always have to start with a latrine that costs you, say, $100, but you can start with something that gives you a start and build it up till you have a good latrine. You can start with a small superstructure and then gradually build it up with like using cemented bricks and using from a wooden slab to a concrete slab. Here you see some pictures of latrine being built with bricks, and here you see an agency that's coming to empty the latrine, because this latrine will be full sometime, as I said, about 4 or 5 years, and then you need to empty it before you can reuse it again. And of course, when these guys, they have to dispose the sludge they're collecting, and either it should be at a treatment plant, a sanitation treatment plant, or it should be safely collected. There are potential for sewage systems which don't have to cover the whole town, but you can even have sewage system for a group of houses like you see in this picture. And then there's a central treatment for that house. A big septic tank, for example, would be enough, or a small treatment plant. So there are various components, various possibilities for building latrines. I don't think you, as being a future doctor, will have to know all these technologies, but at least you should be aware that there are simple, cheap technologies which can be upgraded to more sophisticated systems. Most important, as I mentioned, is changing people's behavior. So it's not only to provide them with a latrine, because there have been large programs, for example, in India, whereby the government was providing free latrines to households, and people didn't use it. They just put their bikes in it, or they stored their maize in it, their harvest in it. Because they were not educated well, and they were not tempted to use that latrine well, because they still preferred the open space. So behavior, sanitation are closely linked, and it's a programs that government should be really enrolling and working on. A little bit on the enabling environment, what makes these programs possible? You need to create demand. You need to talk about it. Often you see if somebody in the village starts using a toilet and builds a nice toilet, then he becomes a role model. He will start to influence the others. The same applies to hand washing. If they see that some people are washing their hands every day before eating or after the toilet, people are influenced. So demand creation is important by education, but also by showing good examples. Sanitation campaigns are important. Also training people to build latrines is very important. Then, of course, the marketing of it, social marketing. You have to promote, you have to talk about, say, being connected to a water system, or you have to talk about keeping your latrine clean, because these things just don't happen by itself. Social marketing, making people aware, and promoting the product is very important. There's one approach which is very often referred to, that's the community-led total sanitation. That you'd like to use the social pressure for everybody to behave in a certain way. That if, say, in a village, 10 people have a toilet and are washing their hands, that's not going to make everybody healthy, because there's still a lot of people who don't do it. So you need everybody to use the latrine and wash their hands. And then you will see that the village as a whole will become more healthier. And well, in some cases you call it kind of shaming people, or you wanted to pointing out from these people. But in many cases, it's the community can apply some social pressure, or the leader of the village or the mayor of the small community can say, okay, we have now regulations in place that everybody, every house, building regulations. You can build a house, but you also have to build a latrine and use it. Open defecation is not allowed in our village anymore. Well, to maintain a system of good water supply and sanitation, you have to develop a capacity. You may have to set up programs that are managed, government programs, private programs, but you can also have community health clubs. And it has been demonstrated that particularly women are very effective and are interested in these clubs. And for them, this could be a way to improve the health of their children. Finance, of course, without money, nothing will happen. To build a latrine and to build, say, a small water system, a hand pump, to drill a hole, install a hand pump. Microfinance, loans are very useful. People don't have enough money to build it, but if you provide them with a small loan, they can then use that money to ask a mason or somebody to build the latrine for them. The governance is the process in which you try to say influence decisions making, where you influence the management, whereby you develop certain regulations for a village or for a town or community. Governance is important. You cannot leave water and sanitation and hygiene to the individual alone. It's a common responsibility. Society, the township, or the town or the village, it's a public affair. Water and sanitation hygiene is a public affair. And it's important that the governance of the systems in place are taken well care of. That is applicable for the water supply systems. You need good management to maintain them well, but it's also for sanitation, to maintain the systems well and make sure, for example, that septic tanks and latrines are being emptied in time. Well, I think this was enough for today. It may have been a lot. It may have been confusing. Maybe, by having this type of Zoom lectures, it's not so easy to communicate well. Maybe I wasn't clear enough. Maybe, well, I hope at least I was able to mention to you the importance of water and sanitation and hygiene in people's life. In Holland, we are used and we are always expecting there's a toilet nearby. But in many places in the world, we know there's no toilet. And people still use the bush. And people still have unsafe water for drinking. So whenever you are going to do your practice, you're going, say, to learn more about being a doctor, you're going to travel, say, to Africa, to Latin America or Asia. I really wish you a lot of success, and I hope this lecture has been able to provide you some basic understanding of the importance of safe drinking water, sanitation, and hygiene. Thank you very much. If you have any questions, just let me know. Luca Joe, you want to ask something? Or I see Nadine.
Yeah,
Any
no.
questions? Jan.
I have no questions for you, so perhaps you still have some questions. But
Let's see. Any more questions around, please?
A lot of thank yous.
I
No
see
questions.
we lost some of the participants.
I guess so. So,
54. Oh, okay, we are late, of course.
yeah.
I'm
Can
sorry
I
for
ask you to
overrunning
send me your
time.
slides, Dick? Then I can share them with the students.
Okay, I will do so. I will
Yeah?
send. Yeah.
Okay. Thank you very much then.
Yeah, thank you all very much, and have a nice afternoon. Bye-bye.
Mr. Nouwen, I had a question for you.